Turning 65 and trying to understand Medicare can be extremely overwhelming. With all the different parts A, B, C, D, Advantage plans, supplement plans, makes most people feel like they're trying to solve a puzzle with missing pieces. My name is Carmelo Rosa, and I'm the founder of Rosa Healthcare Advisors, where our main goal is to inform and educate those people turning 65 and entering into Medicare. I wanted to create this video to give you a clear understanding of how Medicare works, the different parts, the time frames, and all the information that you need to not only protect your health, but protect your finances as well. By the end of this presentation, you'll understand exactly how Medicare works and how to avoid the common traps that can cause most people thousands of dollars in medical bills down the line. So let's get right into the slides and start with what exactly is Medicare and who is it for? What are we going to learn in this guide? You're going to learn the basics of Medicare, the different parts, identifying some of your coverage gaps, choosing the right path, making the right choices, and enrollment periods and deadlines. All stuff that's extremely important, yet broad, to understanding exactly how Medicare works. So the truth about Medicare. There's so much information out there about how Medicare works. It's really hard to boil it down and see what really matters the most. You hear things from your friends, from your family, from neighbors, from coworkers. You don't know who to trust, and it makes it that much more overwhelming and frustrating to make your decision. There's a lot of misleading advertisements as well. So you're going to see the ads promising free benefits or free Medicare, but they often have hidden costs and limitations to the actual health coverage itself. Now, the importance of accurate guidance. Reliable, unbiased information is really crucial for making your decision when it comes to Medicare because Medicare is not something that is a broad kind of plan for anyone. There's tons of different options, and it really depends on what your health is like, what your budget is like, and what you think is going to be the best coverage for yourself. So, what is my goal here? I want to be your Medicare compass. Navigating Medicare, like I've said, can feel extremely overwhelming. We're your trusted, unbiased source, empowering your decisions with free support, your Medicare guide to education, to decisions, to enrolling, and for help and support whenever it's needed, not only just from the beginning of the process to the middle, but after as well. Why understanding Medicare matters. Obviously, there's tons of cost implications, your doctor access, your coverage flexibility. There's so many different moving factors when it comes to Medicare that you really need to give yourself a comprehensive understanding of exactly how your coverage is going to work. That way, you know exactly what to expect in the future. So, what is Medicare? Medicare is a federal health insurance program. It was established in 1965 by President Lyndon B. Johnson to provide health care coverage for eligible Americans. Its key beneficiaries are obviously those who are turning 65 and older, but certain younger people as well with specific disabilities are able to accept Medicare before the age of 65. So, are you eligible? Obviously, the most common path is going to be those who are turning 65, reaching the retirement age. If you've also received Social Security disability insurance benefits for at least 24 months, you're also eligible for Medicare. And then specific medical conditions, those with ESRD or ALS can qualify regardless of what your age is. So, the first step of Medicare, as you might say, is going to be the critical initial enrollment period, your initial enrollment period. This is going to be a 7-month window. It's 3 months prior to turning 65, 3 months after, and the month of. So if you're turning 65 in March, it's going to be December, January, February, the month of March, and then April, May, June. Those are the 7 months that you have to enroll in Medicare Parts A and B. And if you don't enroll within those 7 months, then you're going to start to incur a penalty fee. So, chapter one, navigating Medicare, understanding the different parts and how they work, what they cover, where that they're used. So, these are the four main parts of Medicare. You have Part A, which is your hospital insurance. This is going to cover all of your inpatient care. So, any hospital stays, hospice care, skilled nursing, anything that you're admitted as a patient for. Then you're going to have Part B, which is your medical insurance, basically your everything else insurance. This is going to cover your doctor's visits, outpatient care, blood work, lab work, medical equipment, anything that you're not admitted as a patient for. Then you also have Part D, which is just your standalone prescription drug coverage. This helps to obviously cover the cost of whatever your prescription medications are, whether they're brand name, generic, and it goes by a tier system, which we'll get into later on. And then also Part C, which is Medicare Advantage. This is a private alternative to to original Medicare, and this bundles parts A, B, and D, your drug plan together, basically like a managed care plan from a private insurance company. So, Part A, your hospital insurance. So, Part A primarily focuses on inpatient care received in various medical settings. So, what does Part A cover? Inpatient care in a hospital, skilled nursing facility, short term care after a hospital stay, hospice care, support for individuals that may have a terminal illness, and some home health care, limited care provided at your home. So, as for a premium, which premium is going to be your monthly amount, there is, for most people, a $0 premium for Medicare Part A because either yourself or your spouse has paid Medicare taxes through employment for at least 10 years. So every time you've gotten your check and you see that Medicare tax come out of there, that's been going towards paying for your Part A of Medicare. Now let's grab a piece of paper because I want to calculate your Part A costs with Original Medicare. Now, Original Medicare, if you have a hospital stay, let's say, something happens to your health and you end up in the hospital, you're going to have a per occurrence deductible, meaning every time you are admitted to the hospital, you are going to have to pay the amount of $1,736 in 2026. So that is absolutely required by anyone on Medicare to pay this per occurrence deductible when they're admitted to the hospital. Medicare covers 80% and you pay 20%. So before Medicare pays that 80%, you're going to have to meet this deductible of $1,736. And keep in mind, this is a per occurrence deductible. So it's every single time you are admitted to the hospital. Medicare Part B. Part B is essential for covering your routine medical services outside of inpatient hospital care. So I like to call this your everything else coverage. Like I said in the beginning, this is your doctor's visits, your specialist visits, your blood work, your lab work, your heavy duty medical equipment, services like x rays, lab tests, emergency room visits that don't require an inpatient stay, preventative services, screenings, vaccines. Like I said, durable medical equipment. That's your wheelchairs, walkers, oxygen equipment, whatever it may be. This is all covered by Part B. But unlike Part A, Part B does have a monthly premium. And remember, premium is that monthly amount that you are paying. The premium amount can vary based on your income, and we'll go into that a little bit as well later. But the standard Part B premium for 2026 is $202.90. Now, if you're planning on accepting your retirement income, this Part B premium is going to be drafted automatically each month before you receive your retirement benefits. But if you're not planning on accepting your retirement income, no worries. The only role that that plays with Medicare is going to be if you're not accepting it, then your Part B premium will be paid from a separate account, whether that's a checking account, by a mail in check, however you prefer. It's just not going to come directly out of your retirement. So let's grab another piece of paper and calculate your Part B costs with Original Medicare. So, unlike Part A, The deductible for Part B is an annual deductible, meaning it's one time and it's yearly. The annual deductible for Medicare Part B is $283 for the year of 2026. So remember, this is annual. It's only once and it's once per year. And like I said, Medicare is going to cover 80%, and then you're going to be responsible for 20%. But you have to meet this $283 deductible before Medicare starts paying its share. Now, this is really crucial to understanding how Medicare works. Your out of pocket costs have no limit. So, remember how I just said Medicare covers 80% and you're going to be responsible for 20%? Well, there's no out of pocket limit to that. There's no out of pocket maximum. So 20% of an unknown number can be a very, very large number. Think of it like this. You go for your annual checkup, 20% of that isn't really going to be anything to worry about. Now, what happens if you have a 7-day hospital stay and maybe you need some surgery? 20% of that is going to be a insanely large bill. That's going to be something that is really, really difficult, and it's going to be hard to pay that 20%. So you always have to keep in mind, critical point to remember. Medicare Parts A and B do not have an annual limit to your out-of-pocket expenses, meaning your financial responsibility for that 20% could be basically unlimited. There are gaps in Medicare coverage. We've gone over a couple of the things so far. So original Medicare Parts A and B provides essential coverage, but it does leave some significant gaps that can lead to unexpected costs. It does not cover everything. 20% gap can be as little as a few dollars or as large as thousands of dollars. And a Medicare supplement is designed to fill those gaps and cover those out of pocket expenses. So, chapter 2, choosing your coverage. There's really two paths when it comes to how to navigate Medicare. Obviously, you have original Medicare, but after that, these are your options. You can go with a supplement plan and a standalone drug plan, or you can go with Medicare Advantage, which encompasses all of them together. So let's say you go with original Medicare and a supplement plan plus drug coverage. That combines, Medicare, original A and B, with the supplement plan and the drug plan. It lets you keep or choose any doctor, hospital, or provider. It's the most widely accepted insurance plan in the United States. Original Medicare is actually accepted by 98% of doctors and hospitals in the country. Even your very well-known hospitals, Sloan Kettering, the Mayo Clinic, any of these specific and specialized hospitals that you may want to go to receive the best treatment, they all accept original Medicare. Another thing, no referrals for specialists. So no matter who you want to see, whether that's your primary care physician or you need to go see a specialist for something you may have going on with your health, you're never going to be required to get any referrals to see those people. All you have to do is just schedule an appointment and show up with your Medicare card. National coverage that travels with you. So you're not limited to staying within your zip code or your county. You can travel with original Medicare and a supplement anywhere in the country. So when you're going to see family or going to see friends, going on vacation, even traveling out of the country, you are always covered by original Medicare, and you never have to worry about your coverage, not being accepted when you're away from home. Coverage is guaranteed for life. Original Medicare with a supplement plan is guaranteed renewable. Your coverage can never be canceled, regardless of what your health looks like. Only way your coverage would ever be canceled is if you fail to make your payment. But other than that, you always have the peace of mind to know that your coverage is going to be there every single year. And no matter what happens to your health, you're never going to be taken away from that coverage. You can change your plan any time of the year. So that's a huge thing with original Medicare and a supplement. You are not restricted to specific time periods or windows during the year that you can, change or remove or add your coverage. You can do it at any time, and there's no penalties to doing that. And then the last thing here, you eliminate all copays and deductibles with a Medicare supplement. Now, all of the deductibles we spoke about before and the coinsurance, all of those besides one are eliminated with a supplement plan. And I'm going to go into that in a little bit here. But just know that all of those gaps in coverage we just spoke about, they're all eliminated when it comes to original Medicare with a supplement. Now, let's compare that to path two here, Medicare Advantage. This path bundles some benefits of Part A and B along with a drug plan, and it's often advertised as free Medicare or zero cost, $0 Medicare. These plans, they vary from county to county, so they're always going to be different. There's no national coverage, so it's not guaranteed that you'll be covered anywhere you go. Most likely, when you have a Medicare Advantage plan, you are restricted to the area that you live or the zip code you live in, and you have to find doctors and specialists in that area that accept your specific plan. There's hundreds of different options. You will need referrals for specialists. So no matter what's happening with your health, if you're going to see someone who's not your primary care doctor, you are going to need a referral to go and see them. You're going to need prior authorization for all medications that you're taking, depending on their tier. You may need prior authorization to accept or to pick up those medications from the pharmacy. Network restrictions. This is really the biggest thing when it comes to Medicare Advantage. They are extremely restrictive coverage. They are not nationwide coverage like original Medicare. Like I said, original Medicare is accepted by 98% of doctors and hospitals. Medicare Advantage is completely different. The plans are all different from each other, and doctors accept specific plans. So you have to really, search to find doctors that are taking your specific Advantage plan. And a lot of the times, people are faced with the decision to have to leave doctors that they've maybe been seeing for the last 20, 30, 40 years of their life. Insurance companies are in charge of approving procedures. So, no matter what your health may look like, if you're having some issue or some, you know, there's really two coverage paths when it comes to building your Medicare coverage. You have path one, which is original Medicare with a supplement plan and a standalone drug plan, as well as path two, which is Medicare Advantage. So when it comes to path one, this combines original Medicare Parts A and B with a supplement plan, or it's also called a Medigap plan, and a drug plan. Now, when you have this, you can keep or choose any doctor, hospital, or provider that you please, whether this is someone you've been going to for your entire life or, you want to try someone new. It brings us into our second point here. It's the most widely accepted insurance plan in the US. It's accepted by 98% of doctors and hospitals in the country. So you really never have to worry about someone not accepting your coverage. And it really just makes it super simple to finding the best doctors for yourself or keeping the same ones that you've had forever. Now, the next point here, no referrals for specialists. If you need to go see a specialist, you're never going to be required to have a referral to go and see them. And you have the freedom to go and see them at any time, as well as national coverage that travels with you. So not only can you use it anywhere in your state, you can use it in any other state in the country, any territory of the US, anywhere in the US that accepts original Medicare, your coverage is accepted. So whether you're traveling to see friends, family, whatever you might be doing, vacation time, you always have the peace of mind to know that no matter where you go, you are covered. Coverage is guaranteed for life. It is guaranteed renewable. The only way your coverage can ever be taken away from you is if you failed to make your monthly payment. But other than that, regardless of what may or may not happen to your health, your coverage can never be taken from you. You can change your plan at any time of the year. So you don't have specific time frames or windows that you can change your plan. You can do it at any time without any restrictions, and there's no penalties to do that. As well as you eliminate all copays and deductibles with a Medicare supplement. So We talked about it before, and I'm going to talk about it again in a little bit here. But all of the copays that come with original Medicare, as well as most of the deductibles, co-insurance, those are all fully covered at 100% when you have a Medicare supplement plan. Now, you also have Path 2, which is Medicare Advantage. Now, this path bundles some benefits of Part A and B along with a drug plan, and it's often advertised as free Medicare or $0 Medicare. But what you'll come to realize that free Medicare and $0 Medicare, zero premium Medicare is not the same thing as zero cost Medicare. We'll get into that in a little bit. But as for what comes with Medicare Advantage, the plans vary from county to county. There's hundreds of different options for Medicare Advantage, and they're not standardized like original Medicare is. There's no national coverage. So, you're not going to be covered wherever you travel in the US. You may be restricted to, only seeing specific doctors and hospitals that take your specific Medicare Advantage plan. You're going to need referrals for specialists. So, any specialist that you are going to see, you are going to need to be referred in order to go and see them. Prior authorizations. You're going to need prior authorizations for any medications that you're taking that require it. And it just makes it that much more difficult to get the medications that you need. There's network restrictions. This is the biggest thing when it comes to Medicare Advantage. Like I said, there's hundreds of different options, and they are all completely different. There's no standardization when it comes to these plans. So just because you've been seeing your doctor for the last 30 years of your life, it doesn't necessarily mean that they're going to take your specific Medicare Advantage plan. And if that's the case, then you're going to have to go find new doctors, or you're going to have to find a new plan. And you may not be within your enrollment window in order to switch that. The insurance companies, they're in charge of approving procedures. So whatever may happen to your health, it's not always guaranteed that you're going to be able to get the right procedure and help that you may need. It's going to need to be approved by the insurance companies, the provider of your Medicare Advantage plan. Co-payments and high out-of-pocket costs. This is really the biggest thing when it comes to Medicare Advantage. On average, the deductibles of these plans are thousands of dollars. People don't realize that when they sign up for them. As well as, not only do you have a high deductible, you're also going to have co-payments when you go to the doctor. So you're going to be paying out of your own pocket for everything that you have done, any work, whether it's an annual checkup or something more. Your doctor and hospital may leave the network. These plans, like it says in the next few points here, are not guaranteed renewable. Doctors and hospitals can stop accepting these private plans at any time they feel. And, that may be an issue for you if, like I said, you've been seeing these doctors for years and maybe you don't want to switch, or, you have someone that you might be seeing and you have this specific plan they don't take. The plan can be canceled. So unlike original Medicare, Medicare Advantage can cancel your plan at any time. If the company's going out of business, or whatever the reason is, they feel like canceling your coverage, it can be canceled and it is not guaranteed renewable. They operate on a 1-year term. So your Medicare Advantage plan is only available for 1 year. And like I've been saying, it is not guaranteed renewable. That plan may not be available to you in the next year. And more than likely, you will need to find a different option. Then also they have lock-in periods. There are only specific months within a 12-month period that you can change your Medicare Advantage plan, disenroll from your Medicare Advantage plan, and really do anything with it. You cannot do it at any time of the year. So the supplement path, this is what I like to call your layered protection. Medicare stays your primary. So you're going to get your Medicare red, white, and blue card in the mail. And this is your parts A and B. It remains the foundation of your coverage. It's always going to pay its share first, cover 80% of all of your health needs and health costs. And then the supplement fills in the gaps. So a Medicare supplement, it steps in to cover the out-of-pocket costs like deductibles and co-payments and co-insurance. It fills those gaps that are associated with Medicare. And then add your drug plan on top of those. This is a standalone Medicare Part D plan that provides coverage for your prescription medications. This is different for everybody. Even if you're taking no medications, you still need to enroll in a drug plan. And this all varies on the tier of medication. So costs of these can, like I said, vary depending on what it is that you're taking. And we'll get into that later on. So, what do supplements cover? Medicare supplement plans, or also called Medigap plans, are designed to help cover the out of pocket costs that come along with original Medicare. The costs that, the 20% we've spoken about. So, what a supplement plan does is it really provides a comprehensive and predictable healthcare experience. So, those pesky health insurance costs that pop up unexpectedly are a non factor, and it's something that you don't have to worry about. So, the first term here is coinsurance. This is the amount that you would pay after Medicare pays its 80% share. And this is after you've met your deductible. But Medigap or a supplement plan covers this portion. You then have your deductibles, obviously. Medigap plans cover most of the deductibles that you must pay out of pocket before original Medicare starts to pay for your care. Now, the only deductible that you'll ever have to worry about with a supplement is the Part B annual deductible, which for 2026 is $283, like we've spoken about. Now, this is the only deductible, really the only out of pocket cost that you have to worry about when you have a supplement plan. Now, hospital gaps. These plans cover certain costs for hospital stays that original Medicare may not fully pay for, such as costs after certain benefit periods are exhausted. There are different amounts for coinsurance that you would pay after you've had an extended hospital stay, and they only increase the longer that you're there. So if something serious happens to your health and you're in the hospital for quite a bit of time, you want to make sure you have that supplement plan so that you're not responsible for paying that out of your own pocket. And then lastly, it just covers and provides predictable bills for you. It covers a large portion of your out of pocket costs, and it really makes your healthcare expense more consistent. And like it says here, manageable. That's really the main thing. Is it reduces the unexpected bills that happen. Now, these are your Medicare supplement plan options. So these plans are standardized, meaning that no matter which insurance company you choose for your supplement plan, benefit is going to be exactly the same. That benefit is to cover the 20% gap that Medicare does not cover. So feel free to pause this and take a look at everything here. I won't go over all the plans in their detail, but the main ones that you want to look at are Plan G right here in the middle, Plan F, as well as Plan N down here at the end. Now, I'm going to talk about it here in a second, but Plan F is no longer available. It's no longer offered. This is only for people who were born on or after January 1st of 1955. But Plan G is going to be the absolute best option. You can see here in coverage, the only gap or difference that happens between F or G, F covered the Part B deductible that we've spoken about, and G does not cover that. So typically your F plan is going to be more expensive than your G because it covers that deductible. But like I said, this F is no longer available to anybody who was not born on or after January 1st of 1950. So, like I said, the most common and comprehensive Medicare supplement plan. This is Plan G and Plan N. So, what does Plan G do? Plan G is going to eliminate all of the costs or gaps that come along with original Medicare, including the Part A per occurrence deductible, all skilled nursing facility coinsurance payments, as well as any Part B coinsurance that you might get when you're going to the doctors or a specialist. Only out of pocket costs that you'll have with Plan G is, like I've said, the annual deductible, which is $283 for 2026. So the way that's going to work is the year or the month that you turn 65 and your Medicare goes effective, you are going to pay $283 out of your own pocket when you go to see your primary care doctor for an annual checkup, or maybe you have a hospital stay, you'll pay $283, and then Medicare will cover 80%, and your supplement plan will cover the remaining 20% that you would normally be responsible for out of pocket. Now, you also have Plan N, which is almost the same as Plan G. Now, the main difference is that it's going to be a bit more cost effective for yourself, and it's going to cover most of the gaps, including Part A and any skilled nursing facility co-insurance. But you are going to be required to pay copays. Now, this is up to $20 for office visits, so your doctor's visits, specialist visits, anything of the sorts, and then up to $50 for emergency room visits that you are not admitted as a patient for. Now, this also does not cover any Part B excess charges. So, for example, if a doctor charges $115, but Medicare only approves $100, the $15 excess charge, or up to 15% of the approved amount, is your responsibility to pay with Plan N. So, most people do decide to go with Plan G just because it offers the most comprehensive coverage and it really eliminates all of your costs that you would normally be responsible for out of your own. Now, the supplement strengths. You can see any Medicare doctor. So, like I said, this is any doctor or hospital in the country that accepts original Medicare. This is 98% of them. You never have to worry about if they accept your specific supplement plan. The only question that you ever need to ask is, do you accept original Medicare? If this is a yes, then you're good to go. You don't have to worry about your coverage not being accepted there, because if they take Medicare, they take your supplement. There's no networks. You are not restricted to a specific network of providers, offering flexibility for you to choose anywhere that you'd like to go. No referrals. You don't need referrals to see any doctor or any specialist, allowing for direct access to care and 100% coverage. When you have a supplement plan, you are covered at 100%. All Medicare approved medical expenses are covered fully after your deductible has been met. So here's a comparison table of Medicare supplement plans and Medicare Advantage plans. Now, this is crucial for making your decision here. So it's feature, original Medicare, supplement, Medicare Advantage, your doctor access, any doctor with original Medicare, with Medicare Advantage within your network. Costs, extremely predictable. You know what your premium cost is each month. You know what your annual deductible is. Once that's met, then you have no out-of-pocket costs. This is usage-based for Medicare Advantage. So wherever you're going, whatever you're having done, it all is based on how often you're using it, where you're using it, and what you're using it for. These are all going to have different costs associated with them, whether that's copays at the doctor's office, high deductibles, maybe thousands of dollars that you have to meet before your coverage even kicks in, or just in general at the hospital, wherever it may be, you're going to be paying out of your pocket. Premiums. Premium with original Medicare and a supplement is going to be a bit higher because you are trading the lower cost to, this is obviously lower with Medicare Advantage, but Medicare Advantage is advertised as $0 Medicare or zero premium Medicare. This is not the same thing as zero cost Medicare. Medicare Advantage is extremely affordable until you need health care. Like I said, you have deductibles that are thousands of dollars. You have high copays at the doctor's office, and you definitely have high copays at the hospital. This is something that you really need to watch out for when you have Medicare. And then travel. The original Medicare plan with a supplement is nationwide as well as out of the country. You're covered up to $50,000 out of the country when you have original Medicare with a supplement plan to get you back in good condition to come back to the United States. Medicare Advantage, it's the exact opposite. It's regional. It's almost always based on the zip code that you live in or the county or town that you live in. If you try to go anywhere outside of this, it's going to make it extremely difficult for you to use your coverage, and it's going to be a real headache when something happens to your health. So, cost philosophy. Predictable protection when it matters the most. This is original Medicare with a supplement. It is built around predictability and access. Instead of shifting costs through copays and restrictions, it minimizes your out of pocket expenses. Once you've met your deductible, then you are covered at 100%. Nationwide coverage, no matter what you may need it for. You know exactly what you're paying, and there's no surprises. Like I said before, Medicare Advantage, it's affordable until you need it. The plans are structured around managed care. Premiums may be low, but costs are controlled through networks, prior authorization, and per service copays. So you're paying every single time you go to the doctors. You have a deductible that's thousands of dollars. You are controlled by the insurance company that offers your Medicare Advantage plan on how you can use the plan, where you can use the plan, and it just leaves you financially exposed. So let's get into Part D, which is your prescription drug coverage. This is a standalone plan with Original Medicare, and it is bundled with Medicare Advantage. So it's based, your cost is based on the medications you're taking on a tier basis. So these are your Part D out of pocket costs for 2026. So you have up to $615 deductible. This varies from plan to plan. You have an initial coverage benefit of $2,100. So this is the max amount that you will pay in a given year for your drugs. Once you've reached that, then you will pay $0 for your medications. And then you have your catastrophic coverage. So once you've incurred the maximum out of pocket, your coverage does not end. All your medications, like I said, are now covered at 100%. And then your plan restarts every year. So no matter what, everything resets. So your deductible resets as well as your coverage, initial coverage limit resets. And you also need to make sure that you are on the best drug plan for yourself at the end of every year. This is something that I will also go over here in a little bit, but this is something I review with my clients to make sure that they are on the best plan for themselves. So let's talk drug tiers. Obviously, the Part D plans organize their medications based on tiers. The lower the tier, the lower the cost. So your out of pocket costs depend on which tier your medication falls into. Tier one being your generic preferred brands, tier two being your preferred brand name medications, tier three being your non preferred brand name Medicare medications, and tier four and five being your specialty drugs. So obviously, tier one and two drugs are going to have the lowest copays, while tier four and higher specialty drugs have the highest. Okay, so enrollment windows. October 15th through December 7th. This is the annual enrollment period, also called AEP. This is the primary period each year when you can make changes to your Medicare drug coverage. During this time, you can also switch from Original Medicare to Medicare Advantage or vice versa. And you can also change from one Medicare Advantage plan to another or enroll in a new Part D prescription drug plan for the new year. So, working beyond age 65. This is a question that comes up quite a bit. You can still enroll in Medicare Parts A and B if you're going to continue working. But I would talk to your benefits administrator on what your best option would be in terms of employer coverage, if you're going to be allowed to continue on that plan. But if you are, make sure you keep records of that group health insurance from your employer, because you'll need that later down the line when you decide to fully enroll in Medicare Part B. When you do retire after age 65, you are eligible for special enrollment period. This basically makes it so that you do not receive any penalties to enroll in Medicare at the time of retirement. But you are only allowed 8 months after your employer coverage ends to enroll in Part B. If you do not enroll within that 8 month window, you will start to incur a penalty fee. And it's also obviously recommended to sign up before retirement, so there's no lapse in coverage. Now, unlike Part B of Medicare, for Part D, your drug plan, you only have 63 days to enroll in a drug plan after your employer coverage ends. And you will receive the same penalty if you do not enroll in a drug plan before those 63 days end. So, special enrollment periods. You can enroll in Part B anytime you are still covered by the group health plan or during the 8 month period that begins the month after your employment or coverage ends, whichever happens first. But Cobra is not considered eligible coverage. You are not eligible for a special enrollment period based on Cobra. Typically, Cobra is offered for 18 months after employment or coverage ends. You only have 8 months to enroll in Medicare Part B when you are eligible. So you have to enroll at first when you're eligible. Your coverage based on current employment does not include Cobra, retiree coverage, VA coverage, or individual health coverage. Like I said, you must sign up for Part B when you're first eligible. The only credible coverage that is sufficient for Medicare, if you're not already on Medicare at 65, is active employer coverage through yourself or your spouse. Now, what about an employer that has less than 20 employees? In this case, the employees participating in the company health insurance have to have Medicare Part B. One, because the government considers Medicare the employee's primary insurance and the company insurance as secondary coverage. So let's say you're eligible for Medicare Part B. You don't enroll thinking that you had coverage through your company's health insurance, and a major medical event happens. The health insurance company doesn't cover the medical expense because they thought that it was covered by Medicare Parts A and B, and now you don't have Medicare Part B. So you have to enroll in it, now incurring a penalty fee, and you're left with huge financial exposure. So if your company has less than 20 employees, then you are required to enroll in Medicare Part A and B. So Medicare parts and cost overview. Medicare Part A is your hospital coverage. This is $0 a month. You pay nothing per month for Part A. Part B is your doctor's coverage or your everything else coverage. This is $202.90 per month in 2026. This is the standard premium that everyone in the country pays. But keep in mind, you must be enrolled in Medicare Part B to get either a Medicare supplement plan or Medicare Advantage. Part 3, your Medigap/supplement plan varies by age, gender, and zip code, also by tobacco use. And Part D, your prescription drug coverage, it's as low as $0 a month in most states or in most zip codes. And this all depends on what medications you're taking. So, how to choose? Obviously, there's a lot of factors that come with making your Medicare decision, but it really can boil down to just a few points. You know, who do you want the flexibility to go and see? Do you want to be able to see any doctor that you want, the best doctors that are available, or do you want to be restricted to super tight networks and maybe have to give up the doctors you've been seeing your entire life? What are your travel habits? Do you travel out of your hometown or state or internationally? Um, do you want coverage that you know is going to be accepted anywhere you go? Or do you want something that is only going to be, accepted within your zip code? What are your budget and costs? Are you looking for a lower monthly premium with variable costs that, are thousands of dollars out of your own pocket? Or are you okay with, paying a monthly premium, a higher premium, so that you know exactly what your costs are each year and any health issue that may arise is covered at 100%? And then really the biggest factor is what is your risk tolerance? Um, how comfortable are you with the potential for higher out of pocket costs? Um, if you need extensive medical coverage, you know, um, the risk tolerance is really what it boils down to, and having a Medicare supplement plan with original Medicare just absolutely guarantees that whatever may happen in the future, you are covered at 100% and you have nothing to worry about. So, what is the preferred choice? It is the supplement plan path. It provides flexibility and predictability so that you know exactly what you are paying when you are paying it. And no matter what happens in the future, whether you are the healthiest person on the planet or have a whole list of medical issues that you may have been dealing with for quite some time, your plan's always going to be there. It's always going to pay 100% of the bill. And you never have to worry about any surprises that may pop up with your health or with expenses. So, what is my role? I don't work for the insurance companies. I work for you. I am an insurance broker. I am contracted with multiple different insurance carriers across the industry. And I make my decision based off what is going to be the best for you. Um, so, I can show you the available plans. I educate you and I help you to understand how everything is going to work. I help you with your drugs, your coverage, and its costs. And I help to manage your total cost when it comes to your health with premiums and out of pocket. I am basically like your Medicare concierge. So I'm not just here to write the policy and disappear. I am here for you, for my clients. I want to be the best service possible to you, whether that's the beginning process of educating and understanding, the middle process of just getting everything submitted and enrolled, as well as the process after that. So every year, reviewing drug coverage. Anytime you have questions about your doctor's office or your a bill you receive in the mail that you're not sure if you are required to pay, all my clients have full access to me to um, ask me these questions, and I am happy to help you with whatever it may be. Um, my role is to compare all paths and to help you make your decision on what is going to be the best for your health. Guys, thank you so much for watching. I hope you were able to make it to the end of the video. I created this video to give people a broad but extensive understanding of how Medicare works, the parts associated with it, the enrollment windows that are required. Now, I did not go over everything that comes along with Medicare, so please schedule your Medicare review. There's a lot of parts that are very specific to each person's situation. You can call me at 860-770-2583. I can help anybody in the country, whether you are approaching 65, already 65, or over 65. I am happy to have a conversation with you and help you with whatever questions you may need. You can also visit my website, rosahealthcareadvisors.com. You can see this video there as well as a whole list of other Medicare blogs with some general information. Again, guys, thank you so much for watching this video. Please give me a call if you have any further questions, and I look forward to speaking with you soon.